been riding in the sand dunes in Glamis, California for probably 15, 16 years. A week before Christmas, 2015, we had just done a good run, probably 20 some miles, and we're coming back to camp. All of a sudden, it was I felt like a lawn dart. It went from me looking at camp off in the distance to me feeling like my head was stuck in the sand like a lawn dart, and obviously I went off something I shouldn't have. From what I remember, I didn't black out or anything, but they told me they peeled the bike off me. It had landed on me, and I remember the impact, um, and telling myself that this isn't good. I could feel my legs, but I couldn't move them. They called in a flight for life and loaded me up on the backboard and whatnot, and we're going to send me to a California hospital there. Which, us being from Phoenix, we're like, any chance of getting us back to Phoenix? Was dropped off at a West Valley hospital where they did the MRIs and the CAT scans and all the stuff needed to do to assess. Pretty much determined that yeah, you're going in for surgery. It's going to be a major surgery, and what do you do? I said, okay, well, we got to do what we got to do. And from what I remember, the doctor goes off and comes back a little while later, and he tells us, well, my ER is not quite ready, and they don't have the stuff I like to use. We're going to transfer you to Barrow Hospital. I knew none the different. They agreed with the first surgeon that, oh yeah, it's going to be a major ordeal, and but we've got the technology here, and we can fix you. So
So early in the middle of the night, I was called by my resident who told me that he had a middle-aged individual that was out at the dunes riding his ATV and had a rollover type accident, and that he was quadriplegic at the scene. I reviewed the radiographic images that the residents had described to me that Blaine had what's called a bilateral facet lock. And basically what that is when it's a fracture dislocation of the spine. So basically you have a severe dislocation of the neck, and it can't become undislocated, if you will, back into position. So you have ongoing compression on the spinal cord. In these cases, approximately 10% of the people will ever walk again. And the majority of patients are wheelchair bound the rest of their lives. So there are two objectives at the time of surgery. One is to what we call reduce the facet lock, and we do that through a posterior operation. So we started the surgery with him essentially on his stomach. We find where the dislocation is ongoing, reduce them, realign them, and then we put screws above and below the fracture dislocation. And then we connect rods, and then we lay down bone. And because he had such a severe injury, he also needed what we call an anterior surgery as well. So then we flipped him over and re-exposed the front part of his spine. We just are adding supplemental fixation, if you will, buttressing the front part of the spine so that when he gets up later, there won't be a risk of ongoing instability or of the screws coming out. So it's a belt and suspenders kind of operation.
I think we spent a total of 8 days in the hospital, and we're told that I was the 1% that walked out of the hospital. So I'm very grateful there, and very grateful to Dr. Porter for knowing what he knows.
Went to rehab for about a month and a half, and 3 months later, he walked into my office, pretty much unassisted, which was really remarkable. And that's always very gratifying when you have such a good outcome and the whole team came together.
A couple rods and several screws later, I'm standing upright again, and I'm mobile. I hope to be 95%. I think I'm fused 5 vertebrae in the neck, so I know I will never be 100% as far as mobility, but at this point where I'm at, I'm comfortable with what I have, and if it's only going to get better from there, I'm even more grateful.